number 2, understand science of development and behavior. You must understand what is normal for that particular age. And there's a lot of stuff available on the internet. We have the IAP parenting guidelines, the Indian Academy of Parenting guidelines. There are 105 parenting guidelines available on the Indian Academy of Pediatrics website, which is entirely free. I would recommend that you please go and have a look at that. All the developmental milestones are given. Please go have a look at the CDC guide, even website. So I'm telling you all these websites which are very authentic. The American Academy of Pediatrics websites, all these websites have authentic guidelines. Right? When can a child self-feed? Because I see 12 years old, 14 years old being fed by their mothers and fathers. Usually around 15 to 18 months, they should be able to self-feed, provided you give them a chance. Right? We talk about being independent, managing yourself. Right? Right? So please give them a chance to do that so they can self-feed. Okay, when do they start not wetting their bed at night? What, or should I say, let me frame it in another way. What is the maximum time that we can wait before going to the doctor? I sometimes see very harsh punishments given for wetting the bed at night, you know, like tying up of the penis for boys, and sometimes even branding. I've seen that happening even in Bangalore. So till what age can you wait? It's even 6 years, 4 to 6 years. And sometimes there's a family history also to it, right? So we call it primary nocturnal enuresis. That's what we call. And first there is a bowel control and then there comes the bladder control, right? But if suddenly a child who was dry for a couple of months or years suddenly start wetting again, which we call secondary nocturnal enuresis, then we have to see whether there's a urinary tract infection, whether there's worm infection, whether there's candidiasis, or whether there's an emotional problem. Okay? Sometimes when there's the birth of another child, they would start off with this, especially when they're feeling neglected or if they are being, sometimes even being abused, they may come up if there's an emotional distress. Okay? So usually 4 to 6 years is what we would. So these are very important things which we must remember. When do we potty train a child? I've seen some mothers again being very harsh with the potty training, though the diapers are there now and things are much more cooler, roughly at that time, but you should be able to remove your pants, okay? Walk to the toilet and sit there safely. It's around 2 years, and we don't kind of stress them out with it, otherwise they go into constipation problems and all, right? So these are some things to remember, very, very simple things, but we should all remember when are they capable of doing normal things. When do you put them into all these classes like drawing class, dance class? Exactly 5 to 6 years. When they're able to take in, you know, some of the directions and follow them. Though some are prodigies, you know, they start off early, but then please have a look at how the child is feeling after the class. And the child is unhappy. And child is complaining, there's some kind of thing which is happening there, a physical or sexual or an emotional abuse, have your antenna up for that. Though yes, around 6 years would be a good age to go, right? So these are some of the things which we should all keep in mind. So we should be familiar with the normal development. When it comes to puberty, we have lot of changes which occur in the adolescent age group, and adolescence is WHO defines it as 10 to 19 years, but now we know the brain development, as I've been telling you, extends till 24 years. So there is a change in the definition which would be more universally accepted after some time, is 10 to 24 years, and we call them AYAs, adolescent young adults. 10 to 18 years we call them as adolescents, and 18 to 24 years we call them as young adults. So there are a lot of changes which take place. There are a lot of mood swings which happen. They are in an identity crisis. Should I be like my mother or should I be like the auntie next door? And they try to, you know, figure it out in different ways. So we should all be very, the idea of knowing all this is that they don't get into problem. Okay, so if we know what they are going through and this is normal, it would be better. Peers become important, and often parents tell me, he never listens to me, he only listens to his friends, right? And I tell this is an evolutionary thing which happens. After all, for how long will I be alive with my child? My child has to survive with his same age people, right? So he has to develop that friendship, but how to choose the right kind of friends is what you need to really teach them. Maybe get them all together for a get-together, call them home sometimes, get to know their parents, get to know what, do you feel any flag signs, discuss why you don't want him. If you say your friend is very bad, they will never take it. You have to give them a reason. You have to give them a reason, and without being very critical, again as what you're saying, so you have to give them facts, right? So we all have to understand that. Of course, there's always a tug of war, parents pulling one side, the adolescent being pulled the other side by the friends, and of course there's the media when they don't want to listen to us. And again, you know, these autonomy bids are also evolutionary because they want to test boundaries. What boundaries you have put for them, they want to know the reasons, right? And if an adolescent does not question boundaries, then I would be a little, you know, thinking, is the development on track or not? So these are again normal things, but yes, too much of aggression is not good. And yes, an argument or maybe a discussion at the most will be fine, but let it not be abusive either side. So it's like a wild horse, we're trying to control their reins, and we should try our best. And this is what adolescents say, puberty is when parents get difficult. And parents have exactly the same thing to say about the children. So I was telling you about the brain, and these are functional magnetic resonance images which are there, and you can see the blue areas, they show myelination or maturity of the brain. So where are the blue areas maximum, at what age? 20, you can see that. In fact, in the late 20s till 24. And the last area of the brain to mature is in the front, and we call it the prefrontal cortex. Now another question, when is the size of the brain the maximum? When do you think, at what age? 3 years or so, we say very 80% of the brain development, but somebody did mention there's 6. Yes, so the brain size is maximum till around 6 to 7 years. Okay, and after that the brain size reduces. Why is that? If you remember your science, the neurons, they are neuronal connection. So brain follows the principle of use it or lose it. So the neuronal connections which are used the most will persist for life, and the neuronal connections which are not used will get pruned off, like the hedge is pruned off, right? So that is why the brain shrinks in size, but the connections with each other become stronger or hardwired. So for example, if an adolescent in anger throws things, beats up people, and is not corrected, will tend to grow up into a very hot-headed, aggressive adult. But if an adolescent is taught, okay, take a pause, go to the kitchen, count 1 to 10, not even reverse, straight 1 to 10, drink a glass of water, think before you speak, think what are you going to speak, is it what effect it is going to have on the people around you. Not so easy for an adolescent to do, but we can still make a beginning because the brain is flexible at this time. Right? So those connections will get hardwired. So we often talk about bad habits tracking into adulthood. Now I'm telling you about good habits that can be tracked into adulthood. So 10 to 18 years is the best time to intervene with guidance, even if there's a genetic predisposition to say a poor coping style. Here we can really intervene because the brain is under construction. So as puberty strikes, so what is the first sign of puberty in girls? Development of the breasts is the first sign. Okay, so development of the breast is the first sign, and periods usually start 2 to 3 years after that. And for boys, the first sign is enlargement of the testes, but for as parents it's difficult to analyze that. We have an instrument called the orchidometer to measure the size of the testes, so only a doctor can really say whether puberty has set in for boys. Other things like development of the moustache and muscles and all, they develop much more later. So as puberty sets in, the first center of the brain to mature is the center of emotions, and that's why they are going into these mood swings. When they're happy, they're very happy. When they're sad, they're very sad. And the usual time when children are entering puberty nowadays, it's much more earlier, is around 9 to 11 years. I'm talking puberty, right? Development of the breast and the enlargement of the testes. So adolescents become very impulsive also, because the center which controls their emotion only matures in the late 20s. Also the reward center matures. What does this mean? They want appreciation from parents, teachers, and also their siblings and friends. And they also get a dopamine kick, what we say, through various activities like art, music, dance, their academic achievements. And if they don't get these rewards, then they go for unhealthy rewards like excessive media use, speed driving, eating too much. In fact, nowadays the most common cause of obesity, we are saying more and more, is emotional eating. When they feel sad, they take a comfort food, and usually which is loaded in sugar, which directly stimulates the reward center. And of course the drugs are there, which again stimulates the reward center. So if we have to keep them away from unhealthy rewards, we must make sure that they get a high dose of healthy rewards. And often in 10th standard, parents say, stop your music, stop your dance. So people who are good in academics, fine, but those who are not good really lose their dopamine, and then that's a time when they feel very, very sad, sometimes going into clinical depression also. And by the way, you know, most of the mental disorders, 50% of the mental disorders present by 14 years of age, and 90% present by 24 years of age. So as pediatricians, we are saying we are the first people, and then we have to hand them over to psychiatrists so their care is good. So it can set in as early as there. And as I said before, the control center matures only later. So their risk-taking behavior is more. And who is the control center until this center mature? It is the parents, it's the teachers, it is all the family around them, who must teach them how to postpone their rewards, how to really control their impulses. Now, important thing to remember is, if a child thinks or says he wants to commit suicide, never ever tell the child, you are just acting it, I dare you to do it, because the child will really do it, because the prefrontal cortex is not mature. So it's a cry for help. Even if it is an attention-seeking cry, we have to see why the child is not getting adequate attention. So never put that child down, otherwise it may be a problem. Another thing to remember is the cerebellum only matures around 19 years of age, which is the center for muscle balance and coordination. So no driving, no motorized vehicle driving before the age of 18 years, and it's often the parents who give it. And road traffic accidents globally is the #1 cause of death in the adolescent period. So two things are strict no-no. One is motorized vehicles, and the second is alcohol and drugs. Because the brain is still developing, any amount of alcohol, the child, even one sip, two sips, one cigarette, the child can get addicted, and it is a neurotoxin to the developing brain. It decreases the size of the memory center, the hippocampus. Right? So we have to be very, very careful. Sometimes I know parents say, let him have a drink in front of us, at least he will not binge. No, that's a strict no-no. The brain is under development. It will have devastating effects on the brain. So we need to remember that. And as I said, self-control is always very difficult in the adolescent period, and we need to help them. You can't have a bar of chocolate or biscuits there in your house and say, don't eat, don't eat. Not possible. You don't have to have that bar of chocolate or biscuits. Adolescent cannot really resist. So another case, this 13-year-old, so the father said that, he is pulling his hair out. And psychiatrists, so we call that a trichotillomania, and I thought I'll have to send this child to the psychiatrist. But sometimes they refuse to go to the psychiatrist, as it becomes a problem to send them. So again, I sat down, I took a history. This child was very good in football. The parents had stopped the football, and they were forcing him to put him into IIT classes, which he had no interest at all, and he also had a learning problem. He also had a learning disability. So they didn't want to go to the psychiatrist. After 6 months of football coaching and parental counseling, all his hair were back, and we were talking about which hairstyles to have in the summer vacation. So you can see sometimes that, I'm sorry for, kind of stepping on the psychiatrist's career, but sometimes, just simple counseling can really help, and I think parents should be there to be in touch. And you can see, the frown has gone into a smile there, not only his hair, so you can see the change. So we often think as parents, what determines child behavior? So one is the child and the temperament, swabhava. So there are 3 types of temperament. One is the slow to warm children who are very happy-go-lucky, will adjust quickly, and you can make it out when they were small itself, you can make out. Some children are very, what we say, slow to warm up. They'll be a little reserved children. And the third will be very difficult children, always naughty, jumping from here and there and all that. So you will understand that they will all require different parenting styles. You can't have the same parenting thing. And suppose the child is very naughty and aggressive, and if you are very hot-headed, then it is not a good fit. Right? So child is jumping and you are screaming, shouting, child is screaming even louder. So you must understand your child, right? I'm not saying that they have any problem, this is just their swabhava. Parents and parents' personality, parent-child attachment, I'll talk about it in a minute, and the environment around you. How much love is there? Do parents have any mental disorder? Do grandparents have any physical disorder? How much time is being spent with them?